Alexa McRae from Harvard Medical School. I'd like to push back a little bit on your discussion about ontology, centralized databases. And I was going to say that nobody yet had mentioned the word curation, but in your very last slide, you contradicted yourself because you said active curation is incredibly important. So I wanted to give the example of the gene ontology, which I think, at least if you didn't mention it, others have mentioned it. There was a community of people who were trying to solve a problem. They were not trying to solve an ontology problem, for sure. They found themselves mired in that later. But it was the model organism community. And they said, you know what, we have all these different organisms, all these different species. We're learning something, and it's relevant to what we're talking about today. We're learning something about this particular plant. We're learning something about this particular worm or about this fly. And we're learning really good. We're getting very deep insights, but we don't know how to talk to each other because we don't have that semantic interoperability that you were talking about. And then you said, well, you know, get me out of the room when people are talking about ontologies. But what they did was they created the gene ontology. I think that that work has moved the entire field of modern biology forward in a very significant way. And without that, I think we wouldn't have had those advances. So sorry, that was more of a rant.
No. So my entire talk was a rant against that. So,
exactly.
So I think it's a fair point. So I guess I would say this is with full awareness of what the gene ontology folk have done and respect for what they've done.
As an example.
And a great example. I think we need a middle ground.
Mm-hmm.
Speaking as a young assistant professor now and previously postdoc and grad student. Using these large centralized databases is extraordinarily painful. Watching them change is extraordinarily painful.
But it's not a centralized database. It's
well, not the gene ontology, but so right. the centralization is painful. Gene ontology is a little bit, you know, I think there's strong pluses and there's also really strong minuses to it.
One could argue.
So you know, I think the general concept of centralization is what I'm more concerned with. And it's worth noting that there have been a lot of, I think, and I'm not up to date on it because I avoid these efforts like the plague, that there have been efforts to extend the gene ontology approach in other directions that have not been nearly as successful as the gene ontology core approach. And I'm not really sure what's going on or why that is, but I think it's because biologists look at, the straight up bench biologists look at efforts like the gene ontology and say, what a waste of time and resources. Yeah. Only when they actually need to use it do they go, wow, that's great.
Right, right.
And so there's a really weird social problem of recognition for these things. You know, I'm not going to get tenure by working on ontology, on ontologies.
But it's really the larger question of curation. How would we be able to find the literature, or how have we in the past without the medical subject headings and the curation that goes on, you know, in a centralized database?
So I work a bit with Paul Sternberg at Wormbase, who makes a very compelling argument that we're spending far too little money on Wormbase. And other genome databases. And he has a team of intelligent, aware biology PhDs reading C. elegans papers and annotating and curating that database. And it sounds very expensive. I think it's up to $1 million a year or something like that. But what it enables is all this great stuff. And so I'm a big fan of data curation, but they also make all their data available. They make it easy to distribute. You know, it's a very complicated subject.
We'll leave it as you're a big fan of data curation. Thanks.
Yes. Sure.
I'm Ann Richard from the EPA CompTox program. I just wanted to follow on that because I see both sides of this as well. But this issue of ontology versus trying to encapsulate relationships in a way that allow one field to step into another. So the biologist to use the knowledge of the chemist. Matt Martin in the room here took gigabytes of EPA toxicity data for the first time and systematized it into a relational database. I think the underlying issue is also transparency. If you put all these data out with these implicit relationships, people can build on that. They can tear them down, they can rebuild them, but so ontology doesn't have to be limiting necessarily, I guess is my point. And it can be very empowering as the previous.
Lou Gross, National Institute for Mathematical and Biological Synthesis. Titus, I wanted to thank you for bringing up education and training issues as one of the social challenges here. And I wonder if you could give us a little bit of insight from how you think we might, you're doing this at Beacon, how you think we might more effectively deal with this cross-interdisciplinary training of computational science and biology.
Okay. I'll give you a brief response because I'm about to get tackled by Carolyn. Two comments. One is I started out, I was the recipient of a Burroughs Wellcome Fund training grant as a graduate student that was explicitly trying to train people from the math and physical sciences in biology. And Caltech had a number of those grants, and I think it worked well in my case. I like to think. I got a PhD in developmental biology after an undergrad in math. Since then, I've completely abandoned that approach. So the logic was, and this is intentionally, I like to be polemic, so as you can tell. So, the logic was only mathematicians and physicists are smart enough to be quantitative. So we have to bring them into biology. And the problem that you run into is mathematicians and physicists and computer scientists have plenty of really interesting problems that they already understand just fine. And they don't want to learn the biology. And what you really need is people that want to solve biology problems using these other techniques or using these other methods. And so I run a 2-week summer course, intensive summer course on next generation sequencing data analysis, where we bring computationally naive biologists, explicitly naive biologists in and spend 2 weeks teaching them how to run stuff at the command line in the cloud on their own data, and they love it. But it does take about 2 weeks of solid. Now, last year I had 169, this is NIH funded, I got 169 applicants for 24 spots. I had 24 tenure line faculty apply. So there's clearly a strong need. And we're doing a lot of stuff like this, and that approach in general, it's tricky to work out, but it's working. The other comment from the perspective of an assistant professor who does not yet have tenure is that, and this is a very naive, low-level approach, is funding. Nobody funds this stuff. And so I told my program manager that if she made an R01 amount of money available to me for education, I could leverage and bootstrap everything I'm doing and really make a big difference. As it is, I can teach a 2-week course. Because if for $50,000 a year, my administrators tell me, stop doing that. So I think that it really, from my perspective, it comes down to funding. So, but doesn't it always?
It also says that in many respects, universities are not doing their job.
Oh, well, we've known that for a while. I loved the feudal system comparison. Anyway.
So here's a question from George Woodall from the EPA. Question for all to consider. The focus has been on data now being generated and looking to the future. As a human health risk assessor looking at data useful for that enterprise, most is in the archive of published literature. How can we create platforms and linkages between what we already have, archival data, and studies which will never be repeated to the newer data?
So again, I'll just be polemic and just say the biggest obstacle at the moment is the publishers who in general haven't made this stuff available for data mining for some reason. And that's slowly changing. So right now you can't get a hold of it without paying through the nose. So that's a problem. I don't know. I think we'll probably cover that. Let's cover that at a panel discussion.
Okay, thank you. I haven't been at NCSU long enough to